Today in this lecture, we will talk about reabsorption of fluid by the peritubular capillaries and the physical forces, the hydrostatic force and colloid osmotic force that are present in the peritubular capillaries and renal interstitium and their influence on the reabsorption rate. So the amount of reabsorption into the peritubular capillaries is basically determined by net reabsorptive force into filtration coefficient. The net reabsorptive force is then determined by the hydrostatic pressure in the peritubular capillaries, hydrostatic pressure in the renal interstitium, colloid osmotic pressure in the peritubular capillaries, and colloid osmotic pressure in the renal interstitium. Here we have the peritubular capillary in which the reabsorption is occurring. Here we have the interstitial fluid. This is the interstitial fluid. Here we have the tubule cells, the renal tubule cells. These are the cells of the renal tubule. And here we have the lumen of the renal tubule. So we see initially we have this is the peritubular capillary. So the peritubular capillary is here. Here we have the interstitium. Here the yellow color is showing the cells of the renal tubules, and here we have the lumen of the renal tubule. We have discussed multiple times that the process of urine formation starts by filtration. This is the glomerulus, and here the filtration process starts, and then after filtration we have the reabsorption. So we are discussing the reabsorption process, the factors which will increase the reabsorption of fluid and electrolytes from the renal tubule into the peritubular capillaries. So this reabsorption is determined by two main factors, the filtration coefficient and the net reabsorptive force. Now, from where comes the net reabsorptive force? The net reabsorptive force is basically a combination of four different forces, or this is the net force of four different forces that are acting in different directions. So in the peritubular capillary, we have the peritubular capillary hydrostatic pressure, and the value of this pressure is 13 millimeter of mercury. This force is pushing the fluid out of the peritubular capillaries. Now this force is trying to push the fluid out of this capillary into the interstitium. In a way, this force is opposing the reabsorption process. Now this is one factor which influences the reabsorption process. Now there is a hydrostatic pressure in the interstitial fluid, which is being shown with hydrostatic pressure of the interstitial fluid, PIF, and the value of this hydrostatic pressure is 6 millimeter of mercury. So this pressure is forcing the fluid in the direction of peritubular capillary, and this pressure is rather favoring the reabsorption process. Now 13 millimeter of mercury in this direction, 6 millimeter of mercury in this direction, which makes it a net reabsorption of 7 millimeter of mercury. 13 minus 6 is 7. So a net hydrostatic force of 7 millimeter of mercury in this direction, in the direction of interstitial fluid. So this force is being balanced by the other forces, which are the colloid osmotic pressure. Now we have the colloid osmotic pressure in the peritubular capillaries. This force is generated by the proteins present in the peritubular capillaries. This force is pulling the fluid towards the peritubular capillaries. So this is the direction, and this 32 millimeter of mercury is the value of colloid osmotic pressure of the capillaries. Similarly, we have some proteins in the interstitial fluid, and those proteins are also exerting some force on the fluids and electrolytes, and that force is shown by pi IF, which is basically colloid osmotic pressure of the interstitial fluid, and the value of this colloid osmotic pressure of the interstitial fluid is 15 millimeter of mercury away from the peritubular capillaries. So 32 millimeter of mercury in the direction of peritubular capillary, 15 millimeter of mercury away from the peritubular capillary, and the net is 17 millimeter of mercury towards the peritubular capillaries. So this force, this is a big force. The proteins in the blood, the proteins present in the blood in the peritubular capillaries is exerting a big colloid osmotic pressure towards the peritubular capillaries, and this force makes it 32 minus 15 is 17 millimeter of mercury. So this is net force of 17 millimeter of mercury towards the peritubular capillaries. So the hydrostatic pressure was the net force of around 7 millimeter of mercury outside the peritubular capillaries or away from the peritubular capillaries, and the colloid osmotic pressure is 17 millimeter of mercury towards the peritubular capillaries. So 17 minus 7 is 10 millimeter of mercury net reabsorptive pressure, and this is the net reabsorptive force. This 10 is the net reabsorptive force. This force is favoring the reabsorption process of fluid from the tubular lumen, from the renal interstitium into the peritubular capillaries. So this 10 millimeter of this 10 millimeter of mercury fluid is favoring the reabsorption process from the tubular lumen into the peritubular capillaries. Initially, there is some pressure which is favoring the filtration process from the glomerulus into the tubule. So here this pressure is in the opposite direction. It is favoring the movement of fluid from the glomerulus into the tubule so that the filtration process can occur. And now in the tubule, this pressure, this force is in the direction of peritubular capillaries so that the reabsorption can occur. Now the second factor in the reabsorption process is the filtration coefficient. Filtration coefficient is determined by two factors. One is the surface area of the peritubular capillaries. As the surface area increases, the filtration coefficient increases. Second is the conductivity. It is the ability of the membrane of the peritubular capillaries to allow the fluid and electrolytes. So the combination of conductivity and surface area basically makes the filtration coefficient. So the net reabsorption process is a combination of filtration coefficient into net reabsorption force, and net reabsorption force basically is the net force that comes from the two different hydrostatic forces and two different colloid osmotic forces present in the peritubular capillaries and the renal interstitial fluid. And these physical forces in the peritubular capillary and the renal interstitium they have a very big role in the reabsorption rate, the rate at which fluid will be reabsorbed into the peritubular capillaries, which is also a very, very important process in the urine formation. Thanks a lot for watching the video.